The Joint Commission by Avery Bishop, Misty Ferris, and Olivia Riley.
Okay, so to start, we're going to talk about accreditation. And so accreditation is essentially just setting up standards that an organization or facility needs to meet. And so the Joint Commission comes up with a big standard for all facilities to meet. And in order to get recognition by the commission, you have to meet these standards. And specifically for hospitals, they need to meet this accreditation in order to receive funding for Medicare and Medicaid. And so that's another way that they make money. And the Joint Commission kind of was founded out of need. So it started off with a couple different associations that came together, and they found that there were significant kind of deficits in patient care, whether that came from safety and cleanliness and everything. And so the American College of Physicians, the American Hospital Association, the American Medical Association, and the Canadian Medical Association came together and founded the Joint Commission in 1951. And as I said before, it was founded in order to improve the quality of care and safety of patients, and it's kind of a continuous effort, and so each year they set new goals and new standards that we need to meet. And as for the word like joint and Joint Commission, it comes from its beginning, so the different organizations that came together and wanted to have a common goal for it. And the Joint Commission as a whole kind of forms a community between all the facilities and hospitals that are accredited by it. And so that creates a huge standard of care across the United States.
So the organizations that are eligible for the Joint Commission accreditation are hospitals. So that includes general, pediatric, psychiatric, rehabilitation, and critical access hospitals, ambulatory care, which includes clinics, dental and medical practices, dialysis centers, imaging centers, urgent care centers, and office-based surgery practices, nursing care centers, so nursing homes and rehabilitation centers, behavioral health care, so addiction, substance use disorder services, home care, medical equipment, pharmacy and hospice services, laboratory services, so that includes independent or freestanding clinical laboratories. The Joint Commission's competitors. They have quite a few competitors, but a lot of the competitors mostly focus on businesses. So the International Organization for Standards, it accredits businesses, which include hospitals. So its surveys are focused more on the quality of business practices than the clinic quality. They also are more internationally focused. The ASCA, so the Ambulatory Surgery Center Association, is another one. It accredits the ACSs, so it shares its role with the Joint Commission. The American Association for Accreditation of Ambulatory Surgery Facilities, the Accreditation Commission for Healthcare, and the American Association for Ambulatory Healthcare, and lastly, the American Osteopathic Association. So like I mentioned before, the differences between the groups. So the Joint Commission focuses just specifically on healthcare, whereas the other like their competitors focus more on business related topics. So the Joint Commission survey is significantly more rigorous, more clinically focused, and more expensive than its competitors. It has higher standards than its competitors, and being the Joint Commission accreditation is more prestigious than being accredited by any other body. 82% of all acute care hospitals are Joint Commission accredited. So today the Joint Commission accredits approximately 4,168 general, pediatric, long-term acute, psychiatric, rehabilitation, and specialty hospitals. So there's more than 21,000 healthcare organizations and programs in the United States that are accredited or certified by the Joint Commission. So the Joint Commission's mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. And the Joint Commission's vision is for all people always experience the safest, highest quality, best value healthcare across all settings.
So the joint status, the joint status has a deemed status. And one of the questions is, what is a deemed status? So the Joint Commission standards are phenomenal, as it has already been stated. They have very high standards compared to their competitors. And it says that it exceeds that of the Centers of Medicare and Medicare Services. Just as a background, the Joint Commission on Accreditation of Healthcare Organizations, their standards relate to life safety, environment care, and emergency management. So this means that the hospital is required to be able to effectively respond to fires and other emergencies, patient rights, taking care of hazardous waste, and the hospital's plan to respond to an emergency. So those are just a few standards that the JCHO has for their hospitals and healthcare centers. So as a result of having these high standards, the federal government allows all JCHO accredited facilities to automatically qualify for CMS certification. So they're known as having, the JCHO is known as having the gold standard for facility accreditation because of how high and how well their standards are executed in their healthcare units. And so knowing that any healthcare facility can pass the standards for the JCHO gives the government confidence that those same healthcare facilities will meet the standards for the CMS. So there's a survey that actually happens in these healthcare accredited facilities for the Joint Commission. And so there's a process that happens with that. So what happens is the Joint Commission will send in professionals to these healthcare units that they've accredited, and they will interview senior hospital leaders, doctors or nurses, and they'll come in unannounced. But they're only allowed to come in unannounced if the last survey had been performed between 18 to 36 months prior. So they also they track the patient's hospital stay and follow the course of treatment from where it started through every department of service that helps them, so they can determine how well the patient is being treated in their hospitals. And this helps the JCHO know how the patient is being treated and where they can improve upon as well. And so the frequency of these surveys that happen in these hospitals for the Joint Commission, they happen at least every 3 years, and they happen on site. And like I said, they can be unannounced, but only between 18 to 36 months prior to the last survey. So like Misty was explaining, there are some competitors that the JCHO has. And there's some differences, and specifically I focused on the ISO, the international based competitor. And I brought up some differences between the two and why someone would choose not to use JCHO. So the JCAHO, survey is a lot more rigorous than the ISO survey is. And the ISO does have a survey, but it's not, like I said, it's not as rigorous. And the JCAHO is, like Misty explained, it's more clinically focused. It has a lot more medical focus than the ISO does, where it's more internationally business management based. The JCAHO is more expensive as well than the ISO. And being accredited by the JCAHO is more prestigious, and it's good because they're known as having the gold standard for accreditation. But here are some reasons why someone might use the ISO, and it's because it's less expensive, the survey is easier, and the standards for the ISO might surpass the conditions for a CMS, or they might not meet it. and standards are more focused on business management rather than being clinically focused. So as you can tell, there's some downfalls to the ISO and there's some downfalls to the JCAHO, but it's just dependent on what the hospital is looking for, the healthcare unit, if they want to be more business-based or if they want to, the administration wants to focus more on being financially aware. It just depends on which person, what the administration is looking for and how they're looking to provide for their physicians and doctors and patients. So.
All right, so that's our presentation. Hope you enjoyed listening and watching our slides. Thanks.